Let's look at the bones and prominent bony landmarks of the foot. We are looking at the right foot with a medial view. For context, dorsal is up here, plantar is down here, posterior to our right, anterior to our left. The bones of the foot can be divided into three regions. We have the tarsals in the hind foot, and we have the metatarsals and the phalanges in the forefoot. There are 7 tarsals, 5 metatarsals, 14 phalanges. Beginning with the tarsal bones, this is the calcaneus, here is the talus, this is the navicular, this is the first cuneiform, also known as the medial cuneiform. We can see peeking out a bit on the dorsal side. The second cuneiform, also known as the middle cuneiform, and we can see quite a bit showing down on the plantar side of the cuboid. Some prominent bony landmarks for the tarsal bones. This is the tuberosity of the calcaneus here. The plantar fascia, as well as a number of intrinsic muscles of the foot on the plantar side, attach into the tuberosity of the calcaneus. This is the sustentaculum tali of the calcaneus. It is named for sustaining, in other words, supporting the talus above. We should also point out that over here on the posterior side of the calcaneus, the Achilles tendon or calcaneal tendon attaches. And the Achilles tendon is the common attachment for the 2 heads of the gastrocnemius as well as the soleus muscle, and also the plantaris, a small muscle of the posterior superficial compartment of the leg, also attaches onto the posterior calcaneus. Turning our attention to the talus, this is the head of the talus here. Here we have the neck of the talus, and then this area here on top is known as the dome of the talus. There are no muscular attachments onto the talus. In fact, the talus is 70% covered with articular surface. The talus articulates with a number of bones, including the tibia and fibula above, the calcaneus below, and the navicular anteriorly. On the navicular, we have the navicular tuberosity here. That is the principal distal attachment for the tibialis posterior muscle. Now making our way down to the metatarsals. We have 5 metatarsals named numbers 1 through 5 from the medial big toe side over to the lateral little toe side. This is metatarsal number 1 here. This is metatarsal number 5 of the little toe over there. And between we can see 2 other metatarsals in here. We should also point out that we can see the 2 sesamoid bones that sit at the plantar side of the head of the first metatarsal. And on that note, we should say that metatarsals are long bones. Each metatarsal has a proximal expanded end named the base, a distal expanded end named the head, and the body or shaft of the metatarsal between the base and the head. And it's worth noting that the base of the 5th metatarsal has an even larger expanded end, and it comes out to a point, and this is known as the styloid process of the base of the 5th metatarsal. Pointing out attachment sites for muscles, now we can also point out that right at the base of the first metatarsal, as well as on the first, or we could say medial cuneiform, we have the tibialis anterior muscle attaching there, and also attaching right there we have the fibularis longus, right at this base of the 5th metatarsal and first cuneiform. Making our way now to the phalanges. First, let's point out that singular is phalanx. This is the proximal phalanx of the big toe. This is the distal phalanx of the big toe. Plural of the word phalanx is phalanges. These are the two phalanges of the big toe. There are three phalanges in each of the other toes: a proximal phalanx, a middle phalanx, and a distal phalanx. And we can point out in this cadaver that the middle and distal phalanges have fused together. Even though phalanges are quite short, they are technically long bones, and therefore phalanges have a proximal base, a distal head, and the body or shaft of the phalanx in between. So this has been a review of the bones and some of the prominent bony landmarks of the foot on the right side of the body with a medial view. Now that we've reviewed all of the prominent bony landmarks here, let's quiz ourselves. Pause the screen for a moment and see how many of the landmarks you can name. And now, if you would like, pause the screen again and see how many of the attachment sites you can name.